Now we'll move on to Clostridium difficile, C. diff, the bedpan's worst nightmare, the king of diarrhea, or as we've called it, the chocolate factory. Specifically, the title of this drawing is called Field Trip to the Chocolate Factory. So let's get started. If the thought of pipes overflowing with warm, liquidy chocolate at once seemed appetizing, well, spoiler alert, I guarantee it won't seem so tasty after this segment. C. diff, like all other Clostridia, are spore formers. We're going to bring back our walnut symbol here for you to remember this. We're going to draw walnuts on this conveyor belt about to get layered with a coat of chocolate. Again, walnuts for spore forming. So C. diff is a nosocomial diarrhea, meaning people are affected while hospitalized. Spores are easily transferred from patient to patient unless special precautions are taken. A quick wipe down with alcohol will not do anything to spores. The only way to remove the spores is a really thorough wash with soap and water. However, much like botulinum, difficile doesn't do very well competing with normal flora. But many patients in the hospital setting are taking antibiotics. These antibiotics can wipe out the normal flora, so in these patients, the newly acquired spores that the nice medical student just infected them with can then germinate, grow, and produce a toxin which causes all of the symptoms. Some antibiotics are more associated with C. diff infections than others. One of the main antibiotics you'll commonly hear that are conducive to C. diff infections is clindamycin. We're going to draw a sign that reminds the employees the importance of hand washing. Notice it says clean. This is to remind you of clindamycin, clindamycin, and its association with C. diff. To remember that clindamycin is causing it and not what we're using to treat it, we've put it directly over this chocolate stream, near the source of the chocolate. Additionally, the hand washing sign indicates that improper hand washing by healthcare providers, medical students, is a common way C. diff is transmitted. So clindamycin use plus poor hand washing equals copious diarrhea from C. diff. So this is all fairly simple to remember so far. Now we're going to get into some more challenging topics. Topics in which this sketch will hopefully provide a lot of value to you. And these are the exotoxins. There are two exotoxins produced by C. diff. They're called exotoxin A and exotoxin B. Let's set this up from the story side first, then we'll explain how each relate to their respective toxin. We are going to use two workstations to represent these toxins, Workstation A and Workstation B. Workstation A is the Apple workstation. A is for Apple, and A is also for exotoxin A. We'll have Workstation B for the assembly of black licorice, B for black licorice, and exotoxin B. Let's start with exotoxin A, represented by the Apple station. So exotoxin A binds to the brush border of the intestines and causes inflammation, cell death, and watery diarrhea. The first step to remembering this is when you see exotoxin A, think A for apple. A for apple. Really get this in your mind now because on test day, you'll really need to make this connection for the mnemonic to really help you. So A for apple. And when you picture the apples on the conveyor belts, you'll see that they're being picked up by one of the employees and having chocolate brushed on them. This brushing will remind you of targeting the brush border, the chocolate covering, and its close approximation to the chocolate canal will remind you that exotoxin A causes diarrhea. So that's exotoxin A, brush border toxin causing watery diarrhea. Now let's move on to exotoxin B. And same thing, you have to make the connection between exotoxin B and black licorice. Exotoxin B disrupts cytoskeleton integrity by depolymerizing actin, which leads to enterocyte death and necrosis. It also leads to a yellowish-gray exudate that forms a pseudomembrane that covers the colonic mucosa. Thus, C. diff infections can be referred to as a pseudomembranous colitis. So we need to remember actin depolymerization that leads to pseudomembranous colitis. So the first major step is to drill into your mind the connection between exotoxin B and black licorice. Once you think of black licorice, picture their shape. They're kind of long rods composed of parts fused together, a lot like actin. We've even drawn them to look a little like actin filaments all over the place. And we have this little chunky kid who escaped from the rest of the field trip group who is chewing them apart, which represents the depolymerization of actin filaments. To remember the pseudomembrane, we'll have this worker packaging the licorice in sheets of yellowish plastic. And these should definitely get you thinking of membranes. So to review once more, because this is really important, exotoxin A, represented by workstation A for apples, attacks the brush border, causing the watery diarrhea. Exotoxin B is represented by workstation B for black licorice. It causes depolymerization of actin, represented by the kid eating up the licorice, which is shaped like actin, which causes pseudomembrane formation, which is represented by the worker wrapping the licorice in yellow membranes. Got it? Now you should be hoping that they give you questions about these toxins. You'll nail them. So how do we know if a patient's diarrhea is caused by C. diff or by another microbe? Well, there are two ways you can make a diagnosis after you see symptoms. You can visualize the pseudomembranes directly, either histologically or endoscopically, or you can look for a toxin in the stool with various assays, most commonly PCR. To help you remember that it's the toxin that we're looking for in the stool and not the actual organism, we're going to draw another little rebel-rouser kid that escaped from his field trip group and have him playing here in the flowing chocolate. He's literally jumped into the chocolate chute, or colonized it, and even has his feet in it, which is kind of gross. His shoe fell off, went downstream in the chocolate, and was detected by the worker over here. Or the shoe, which is contaminating all of the chocolate, like a toxin, is detected in the stool downstream. Altogether, this should help you remember that it's the toxin and not the actual bacteria that is screened. Almost 1/3 of hospital patients are colonized with C. diff, but not anywhere near that are actually dealing with a C. diff infection. So finding out if there's bacteria in the stool really isn't helpful. But what is helpful is knowing if it's a toxin-producing strain. So you check for toxin in the stool because that's what would be responsible for the diarrhea. Now that we have all the workers drawn, you may notice a couple things about them. First, they all have gas masks on. This is, of course, our symbol for obligate anaerobe, a common feature amongst all 4 Clostridium species. And the second feature is that they're wearing our gram-positive violet. Okay, so let's wrap up with the treatment of C. diff. There are 2 treatment options you should be familiar with for your boards. The first is oral vancomycin. And you may have just heard me say vancomycin, but I didn't. I said oral vancomycin. IV vancomycin wouldn't be as useful. You want to deliver the antibiotics to where the bacteria are, in the lumen of the intestine, so you take it orally. Vancomycin also has poor absorption orally, which is great from a side effect standpoint. So to help you remember oral vancomycin, we're going to draw our vancomycin van here in the back corner of the chocolate factory. And to remind you of oral, well, we'll change this loading ramp into a tongue, and since the back door is open, it kind of looks like an open mouth. The second treatment that is important to remember is metronidazole. To help you remember this, we're going to put up a metro, as in the train, where the rest of the field trip is touring the chocolate factory. The metro train is going to be our recurring symbol for metronidazole. And now we're done with C. diff. And just as an interesting side note, apparently seasoned nurses can detect C. diff just by the smell alone. And I have to admit, this is probably one physical exam finding I'm not going to try to master. But if you guys have had experience with C. diff, please feel free to write a descriptive email about the smell and the consistency to Saud at sketchymicro.com. I think he's passionate about this stuff. And he thanks you in advance. All right, on to the next one.